Right. Hello, Soul Focus family. I'm here. I'm Dr. Lanzano. I'm here with Dr. Tjelle. We're here with Soul Focus. Just as you guys know, if you saw my video last week, a little bit about myself. Dr. Lanzano. I've been to Soul Focus for about 7 years. I'm very happy to be here. I'm a chiropractor here. Dr. Tjelle, we're very fortunate. He's just joined the team, so he's just going to introduce himself, just a little bit about him and how he got into chiropractic.
Hey guys, how's it going? Again, my name is Dr. Grayson Tjelle. I'm originally from right outside Chicago, Illinois. I went to chiropractic school in Iowa. Went to Palmer, same school as Dr. Lanzano, just a different branch. She went down in Florida. I went to school in Iowa. So very similar trainings. And how I got involved out in Soul Focus is I had a internship, a mentor I worked with, a doctor in Iowa who was good friends and colleagues with Dr. Raj, who's the founder of Soul Focus here. So I kind of got hooked up through my internship, and I wanted to be a part of an integrative office. So it really just worked out well for me coming out of school. Been here about 3 months treating patients, and it's been great. Looking forward for this to all kind of dwindle off so we can continue to go on. Today, what we're going to talk about, last week you did just regular back
Low
pain.
back
Correct?
pain, side pain.
Today's topic is going to be headaches. Very common. We see a lot of people with headaches, a lot of people that are getting them when they don't know why. A lot of people are getting more than they should. So on average, you know, anything more than 3 to 4 headaches a year is abnormal, and a lot of people are seeing that in a week. Today we're going to talk about the different purpose or the different types of headaches. So we're going to talk about dehydration. We're going to talk about hormonal imbalance and improper adrenal function, and then we're going to talk about muscle tension. Those aren't the only reasons to get headaches, but those are the 3 big reasons, and we're going to cover those today. And then we're going to show you some stretches, some things you can do at home, and we'll go on from there, okay? So
Right.
Go ahead.
Before we get into the headaches and how we treat them, I just want to let you guys know, I know we're all going through a tough time dealing with COVID-19, the virus that's going around. I know a lot of people don't want to leave their homes, but I just want to let you guys know and reassure you, Doc and I, we were a Soul Focus team. We refuse to, not help people during this time. So we're doing anything and everything we can in order to help people. We're still treating patients Monday, Wednesday, Friday, 10 to 1, 3 to 7. So we're here on the front lines just trying to help as many people as possible. We're doing at-home calls, so if you're afraid to come out of your house, we'll be happy to come to you, give you some treatment, whether it's chiropractic, IV therapy, which is very important. It's going to help strengthen your immune system. People need it now more than ever. We do telemedicine where we'll check up on you. Myself and nurse practitioner will see, how you're feeling, if you're experiencing any symptoms. And we also do telemedicine through physical therapy, and that's with Dr. Parth, or even ourselves. We could help you run through some exercises. We could do it virtually just right here. So we're willing to do whatever, whenever. We're doing at-home kits where we can help strengthen your immune system with the supplements that we have. And we could do physical therapy drop kits where we could bring to your house if you need some supplies at home. So we're doing whatever we can. But let's get right into our topic. And Doc's going to talk about dehydration first, and we'll go from there.
All right, so again, today we're talking about headaches. We'll go through a few different reasons why you might be getting a headache. But first, let's just talk about what a headache is. We're talking about specific pain in your head, right? Pretty simple. It could be just several different common distributions. There's from the neck up the back of the head. Often people will get them up and around the ear, or up and around the head, or straight across the forehead in a wraparound sensation. And those kind of, for us, we use that as a clinical information in order to decide how to give you the best treatment, what's going to help that headache the most. But we don't have too much time to be getting into all that, so we're just going to hit some big hitter topics today, and we're going to start with dehydration. So dehydration, again, you're not drinking enough water, and it's pretty common in our country. You've probably heard of common conceptions like drink 8 glasses of water a day, or simple things like that. What I'm going to tell you, the most up-to-date research right now is to drink half your body weight in ounces of water. So easy math, say I was 200 pounds, half of 200 would be 100 ounces of water, would be an adequate amount of water per day. You have to count down to the actual ounce? No, but get close to half your body weight. If you have any type of water bottle, a lot of them have the numbers labeled on here. I mean, obviously this is a mixing contraption, but a lot of the other water bottles, they have the ounces on there. Any water bottle you buy, the average water bottle is between 16 to 20 ounces of water. So even if you're 200 pounds, you want to drink at least 5 or 6 water bottles of those average 16 to 20 ounces a day. And that should help with that. Another thing with dehydration is a lot of people just aren't drinking enough. It's either the time of the day, you're drinking early in the morning and then you lapse out. So make sure that you're spreading the water intake out. And then just if you're feeling thirsty at all, that means that you're beyond dehydrated. When you're hydrated well and you start to become dehydrated, the first thing you're going to get is that symptom of thirsty, that feeling like you want to drink water. If you're not getting thirsty at all throughout the day, then you are beyond dehydrated. Your body doesn't even know that it needs water. So drink as much water as you can, especially during these times when we don't really have a time schedule. If you're at home, set a timer, certain times of day, physical cues, whatever you need to do, but just make sure you're getting your water intake. That will definitely help with your headaches. Another reason, aside is more of an intake, food, nutrition, that kind of thing. We can get into hormonal imbalances that can cause headaches, and Dr. Lanzano is going to take that one away.
Right. So hormonal imbalances, we get that through a lot of things, primarily through our adrenal glands, and I'm going to talk about in a second. But one way you can check your hormones is getting a blood panel. Your complete metabolic panel won't tell you that, but it's a special blood test where it actually could tell you if your hormones are firing at the right times. For women, if you're getting headaches around your menstrual cycle, it could be an indication that you are experiencing or there is some sort of hormonal imbalance, especially if you're getting around that time. Also, too, adrenal gland insufficiency. So for those who don't know, your adrenal glands, they sit on top of your kidneys. They're these almond or triangular shaped glands that sit on top of your kidneys, and they regulate a bunch of hormones, primarily cortisol, which is your stress hormone, aldosterone, and even adrenaline. So one way to test your adrenal glands is orthostatic blood pressure, going from a sitting to standing position. Now, when you're sitting, that's naturally when you take your blood pressure. So you have a systolic, which is your top number, and a diastolic, which is your bottom number. When you go from a sitting to standing position, what you want to take that blood pressure again. The systolic, that top number, should increase by 10 millimeters of mercury. Now, the reason for that is your adrenal glands, which sit on top of your kidneys, release adrenaline to your heart to pump harder because it needs to send oxygenated blood to your lower extremities so your muscles in your lower extremities can start working, start firing properly. If that number does not increase, that's a good indication where you could be having adrenal insufficiency. Some of the things that we see, main symptoms are headache, fatigue, high blood pressure. If you ever laid down or sat up and felt lightheaded, that could be another good indication, or even sitting to standing and felt lightheaded, that could be a good indication where you have adrenal insufficiency. Now, there's three things that wear out your adrenal glands. Too much stress, which right now a lot of people are losing their jobs. They're dealing with their kids running around at home. Maybe them and their spouse or partner are fighting too much because they see each other too much, whatever it may be. We are under a lot of stress, so too much stress can tax your adrenal glands. Another thing is too much caffeine. A lot of people, because of stress or if they're too tired or they're not sleeping, they are consuming too much caffeine. That could burn out your adrenal glands. And also too much sugar. We, as Americans, we don't necessarily have the best diet. So eating too much sugar, too much caffeine, and too much stress can tax your adrenal glands. So proper nutrition and have everything in moderation can definitely help with adrenal gland insufficiency and could help with hormonal imbalance.
All right, so those again are two more personal reasons that you're getting headaches, things that we might not be able to help you with. We can give you information, we can give you the up-to-date research, but I can't make you drink water. I can't make you stop eating the sugar and the caffeine. Those are things you have to do on your own.
And also, I'm sorry to interrupt, and what I forgot to mention is with some supplementations, which we do have here, that can help with adrenal insufficiency. So just natural supplementation, and again, like Doc said, you guys got to correct your diet. We can't do it for you. We can guide you, but you guys ultimately have to make that decision.
Correct. Make that decision for yourself. And again, anything we can do to help, we are here. Like you said, if you need the supplementation, if you don't know what you need or how to get it, we can help you with that. Again, taking it on your own is something you have to do, but those are things that we can help you with. And the third topic we're going to talk about today that causes headaches is muscle tension. And this was going to be the biggest topic of the three, and this is the topic we can help you with the most as chiropractors. So again, one of the most important things you can do if you're getting chronic headaches, if you're getting headaches often, more than we talked about, more like the average, you want to see 3 or 4 a year would be considered normal. Anything more than that is abnormal. And if you're getting that often, you want to come in and get evaluated. You want to come in, let us do an evaluation, let us do an exam, take x-rays if they're warranted, and we will come to a conclusion, give you the best idea of what's going on, and we can help you with that. With the muscle tension, a lot of times what's funny is that you get pain in your head, but the pain is actually coming from somewhere else. It can be your chest, it can be your neck, it can be your back. And in all those areas, we have a lot of overlying muscles, and those muscles can get overworked to cause tension. They can be underworked and atrophied, meaning they're weak. They're not doing what they're supposed to, which causes the other muscles to work harder. Or you can have just chronic tension, again, due to stress. It's not always overuse or instability. If your shoulder joint isn't working properly, your body will put a trigger point in your back in order to hold the shoulder place where it should be. So it's not always an overuse injury, but these are all things that we can help evaluate and we can help affect. So with the muscle tension, again, one of the best things you can do is to come and get adjusted. If we can get the bones to align better, get those joints functioning properly, the muscles will then follow the bone. They will bring themselves back to the place they should be. When they're out of place chronically, your body thinks that that's normal. And go ahead and pull that in. If you have a tight muscle, say in your shoulder blade, this is just the spine, but this would be the shoulder blade. If the shoulder blade is either out of alignment or not working properly, the muscles that attach to the spine from the shoulder blade like this can pull, and they can pull your spine out of alignment. Mm-hmm. So if we can get these muscles or these bones and joints to work properly, if we can get the shoulder back to where it should be, it gives these muscles time to relax, and then they don't have to pull and create all that chronic tension. Right. So with muscle tension, there's things that we can do. It's always going to be better to have someone else work on you. That's why it is best to come in and see us, or even a massage therapist, or anybody that can help you with the muscle tension. Acupuncture, physical therapy to help strengthen the areas around. So sometimes if you have too much tension in one area, you need to actually go and strengthen the other area. Mm-hmm. So again, being evaluated is going to be the number one thing you need to do. But as far as the treatment for the muscle tension, coming in here, the adjustment, we can do any modalities. We can do cold laser, ultrasound. We can do manual therapy using our hands or any type of mechanical massager, hypervolt. What's the other one? Rapid release. Sorry. Any of the brand name massagers that we have here are also effective. And then most importantly, what today is about is things you can do on your own. If you are not able to come into the office due to our reduced hours, even though we are still open, we can help you. But if you can't come in, or if you are unwilling to leave the house in the situation that we're in, today is about showing you things you can do on your own if you're having headaches. So first, I think we'll probably get into
I'll do some stretches.
Do some stretches first. Okay.
So primarily, we're going to talk about the upper traps, which are the muscles that attach from your neck down to here, and technically they go lower. But primarily, when you get stressed, you're going to hold everything up in here. All my patients, our patients come in, it's like, Doc, I got a lot of tension up in here, and most of the time it's stress, whether it's again something at home, work, finances, wherever it may be. So I'm just going to show you guys some stretches you could do at home that could help benefit you guys if you can't come in. So I'm just going to move this back. And you could do all these sitting down. So what you want to do is take your hand and you want to grab a bottom of a chair, just like this. So what you want to do is take your other hand, reach over on the opposite side of your head, and then you're going to tilt. And what you should be feeling is, and watch when Doc does this, you should be feeling a nice stretch on this muscle from here all the way to here. That is your upper trap muscle. Now, generally the rule of thumb is you could do this 5 times and hold for about 20 seconds. You can time yourself with a stopwatch, or everyone's got a stopwatch on their phone, and you want to do it both sides. So again, you do it on the one side and to the other, again. And then again, that's going to really help with a lot of tension. Another stretch that's very good is called your levator scap. Levator, it means lift, and scapula, it's going to attach to the shoulder blade that Doc was just talking about. So if you just want to turn so I can show them. So your shoulder blade is right here, right where my hand is. This muscle comes from your neck down to the top of your shoulder blade. Now, what we're going to do is, same scenario, you could look back. You want to grab the bottom of a chair, grab the back of your head like this on an angle, and you want to look to the opposite direction and then pull your head down to your armpit. Now, you should really feel that stretch again where I put that, where I just showed you guys. Again, five times each side, hold for about 20 seconds. And then again, just like this on this side. It actually feels really good. You should feel a release in tension. And you could do that throughout the day. Like do maybe 5 in the morning when you wake up, 5 before you go to bed, or if you're sitting working from home and you don't have time to stand up and move around, you could do that throughout the day. Do like 2 or 3 every hour. You can't really overstretch. I mean, I guess you could, but if you have a lot of tension, a lot of stress, that's really what you want to do. Doc, if you actually want to show them, Doc was a massage therapist before he became a chiropractor. He actually worked his way through chiro school. So if you want to show them how to find some trigger points on me.
Yeah, I will do that next. I just want to show them one other thing you can do on your own. So those 2 stretches are really good. And again, if you're looking for time to do them, a lot of people are at home watching TV, watching Netflix, all that. Go every other episode or something where you run through a series of those stretches where you do the upper trap, which is straight to the side. You'll feel it on the side, and then go down into the armpit. You'll feel it more in the back. Do 2 on each, 1 of each on each side, and then the one I'm going to show you now. And if you can just make a little regimen of where you do it every couple hours, you do a couple of each. I think you'll notice a difference. So the next one it's not really a stretch; it's more of an activation, and it's called. Anybody that's been coming in recently, all my patients have seen these. What it's called is a chin tuck, and basically, I'm going to do it with the spine first. So if I'm sitting straight forward, this is what my spine should look like. You should see a little bit of a reverse curve in the cervical spine. And what we see, everybody in our society is very shoulders rounded and head down.
Sit like this.
Whether we're looking at a phone, we're looking at a computer, everything is very forward. So what we want to do is bring the shoulders back and the head up and back as well. So this one is really easy, and it's basically just making a double chin, but you call it a chin tuck so people don't think about it that way. But your head is forward, and you want to bring your head back as far as you can. And what that does is it strengthens the muscles in the front of the spine that when your head is down, they turn off, and those muscles get weak, and they lose the ability to stabilize your neck and keep your head up if you're here all the time. So when you bring your head backwards, straight back over your shoulders, strengthens the muscles in the front, and it gives the muscles in the back a break. Right now, the ones in the back are overworked, and the ones in the front are basically on vacation. So we need to activate the ones in the front, let them know that we're here, and that they need to do some work as well, and then we will give the ones in the back a break. So what it looks like, super simple, just keep your shoulders, again, rolled back and straight, and then all you do is bring your head straight back over your shoulders. And you don't want to see the head tilt at all. You want to keep the top of your head up towards the ceiling, and then bring your chin out through the back of your neck. So you just sit straight forward.
Right. And you're supposed to see a double chin. That's when you know you're doing it right.
You'll see a double chin.
Nobody likes that. We call it kind of like the ugly exercise, but it works great. It's here and then back.
Yep, and it's just straight back, and you want to hold that back position for at least 2 seconds. And you want to do like sets of 10. So if I'm not going to do a full 10, but I'll do a couple where I'm holding, relax, holding, relax, run through a series. If you hold it for 2 seconds for 10, you're talking 20 seconds. Right. And if you can do that 4 times a day, it's a minute and a half. So it doesn't take long. So if you can add it into, get the sideways stretch, the down stretch, do that on both sides, and then do a set of 10. If you can do that 4 or 5 times a day, I would be surprised if you're still having neck pain towards the end of the day. Again, those are all things you can do on your own, some stretches, some activation, and that's all going to be good. If you have, whether it's going to be a tool like a back knobber or a tiger tail, you have a golf ball, tennis ball, or if you have somebody else that you're isolated with, somebody else that you're quarantined with, they can do this as well. Obviously, they weren't a massage therapist like me, but it's kind of the same idea, and anybody can really do it. So we'll start in that upper trap. Once you actually turn around.
Sorry,
yep. So I can just kind of show them the landmarks.
Over here or more?
That's fine. That's fine right there. So if we want to do the upper trap first, like he said, it attaches up in your neck, it attaches out to the AC joint, and then it comes down and attaches in your lower spine. So it's like a big fan-shaped muscle. What we want to do is just kind of feel around, and you can have the patient tell you, they can say, hey, that's a good spot right there, that's more tender.
Yep.
Just feel around, feel until you find a spot. And there's 2 things I'm going to go over here. For one, you can just hold pressure in one position, and you don't have to do anything, and it's called ischemic compression. Basically, we're just holding down that trigger point. The trigger point, I guess I should have started with that. A trigger point is basically a dense bundle of muscle tissue that has contracted and it's unable to let go because there's not enough blood supply, there's not enough oxygen, and we're not getting the micronutrients that the muscle needs to actually let go. So what we're doing is bringing blood flow to the area by massaging it or by adding pressure. You can just hold pressure like I'm doing here in one position, hold it 15-20 seconds, let up, move over ½ inch, hold pressure again. Or if you want to, you can add movement. So if I want to shorten this muscle, the one that attaches here and here, I want to bring his head down into that position. So that shortens the muscle. I'm going to add pressure one more time in that same spot and then slowly pull his head away. And let me switch my position so they can see better. This isn't the best ideal standing position, but so you can see what I'm doing. I'm going to push his head towards the side that I'm going to put pressure. I'm going to add pressure, and I'm going to pull his head away. And underneath my finger, I can feel that tension build. I can feel that muscle rise up into my finger, and he will tell you that pressure where I'm at is increasing as I bring his head away.
Yeah.
And you can do that in any position. I can do that straight to the side, like we did for the lat stretch, or I can bring him down and towards his armpit to get a little later. So it's the same angle as the stretch that you're doing on yourself. Just have somebody else add pressure into that muscle as you go through the stretch. And it's the same thing. You want to hold any stretch about 15 or 20 seconds and do it at least 2 or 3 times and work on both sides. Another common area that you'll see is straight across the bottom of the skull, or what we call the suboccipital region. There's 4 muscles on either side of your spine that connect from just the first 2 cervical vertebrae to the top of your skull, or the bottom of your skull rather. And those muscles are controlling head tilting and then also rotation. So those muscles get used up pretty quickly, especially with our poor posture in our society today. So what you want to do here is, again, just feel around for any palpable mass. Like, the muscle should be soft if it feels rigid, if it feels hard, or if they just says that, if it's tender in there. Same thing with this one. You can just add pressure kind of into the head, but also up towards the skull. You can, again, hold. You can find a new spot and just work around and without doing any motion. Or same thing, I can add pressure and I can turn his head with the pressure. And you can do this down the spine. You can just kind of do that into an easier way to get to the suboccipital region is to have the patient lay down. I don't know if I'm going to be able to get you in. I can just rotate it, I think.
Okay.
We'll have you lay on your back.
Can you see from?
Yeah, I think that looks fine. So you can do this on the floor. You can do this on a bed, anywhere where the patient in this case, or just when you're at home, anybody can lay down. Same thing. I'm going to turn his head to open my workspace, and I'm just going to find that same area just off to the side of the ear and just at the base of the skull. Like if you slide your fingers down, you'll fall off a ridge, and that's where you want to be. And then I'm just going to add pressure straight up. Like if my fingers are underneath his head like this, I'm pushing straight up towards the ceiling. So I'm here, and I'm just going to follow that ridge in. I'm going to push up, and I'm just going to hold right there. And I'm going to let the weight of his head pull the pressure down into my fingers. And this one, super easy. I don't have to do anything. You don't have to be a massage therapist or a chiropractor to do this. Just add pressure. Work with the patient. Always go to their tolerance. You don't want to be causing pain during any of this. It should feel good. When you're working a trigger point, you want to get to, say, on a 1 to 10 scale, 1 being no pain, 10 being a lot of pain, you want to get to like a 5. Mm-hmm. They should feel it, but it shouldn't be painful, and it shouldn't increase their symptoms. So if you're getting pain or increased symptoms, then you need to back off and come and see us. All right, come on up. What else can I show them?
I think it's pretty good.
Okay, so to reiterate, let me turn this a little bit. To reiterate, some of the big common reasons people are getting headaches: dehydration, super easy one, just drink more water, drink your adequate amount of water. The hormonal imbalance, that ties more into diet. It also goes into the adrenal function and some of the other intrinsic things within the body. So those two we don't have as much effect on, but we can definitely give you information and get you all the information you need. When it comes to the mechanical or the muscle tension, that's where we're going to give you the most benefit if you come and see us. But again, we gave you some stretches to do at home, a series of basically 4 neck stretches and an activity and an exercise, and then we showed you some common areas that would be good for trigger point therapy.
All right, guys, that's it for this week. I look forward to talking to you guys weekly. Again, I know we're all going through a tough time. Hang in there. Hopefully this is all over sooner rather than later. But again, we're here for you guys Monday, Wednesday, Friday if you guys want to come in. We'll be happy to come to you guys. Everyone stay well, and we'll see you guys soon, all right?
Have a good weekend.